What if I told you that you could have surgery in the morning and be sleeping in your own bed that very same night? No, it's not science fiction, it's a reality for millions of people, and it's called day case surgery.
I mean, just think about that for a second. A planned operation in the morning, and by evening you're back home recovering in your own comfy, familiar space. It sounds almost too good to be true, but this approach is completely changing the game in healthcare.
So let's get specific. The official term is day case surgery, and it's pretty much what it sounds like, a planned procedure where you're sent home the same day, usually within about 12 hours. The bottom line, no overnight stay in the hospital. So let's break down exactly what this all means.
All right, so here's our game plan. We're going to look at the huge advantages of this modern approach. Then we'll try to solve the patient selection puzzle. It's a critical piece. After that, we'll run through the pre-surgery checklist. And finally, we'll look at the big picture and why this all matters so much.
So let's dive right in. Why is day case surgery becoming the new normal? Well, it's about way more than just convenience. The benefits are actually pretty massive for everyone involved. And to give you an idea of the scale we're talking about, get this. In the UK, a whopping 70% of all surgeries are now done as day cases. Yeah, 70%. This isn't some little niche thing. This is the mainstream way modern surgery happens now. So why the huge shift? Well, for you, the patient, it means a much lower risk of picking up a hospital-acquired infection and, let's be honest, way less disruption to your life. And for the healthcare system, it's cheaper and it helps cut down those long waiting lists. It really is a win-win.
And you might be thinking this is just for really minor stuff, right? Not at all. We're talking about common procedures like hernia repairs, gallbladder removals using keyhole surgery, and even getting lumps or cysts removed. These are all routinely done as day cases these days. Okay, now, as great as all this sounds, day case surgery isn't for everyone, and it isn't for every single procedure. And that brings us to a really crucial part of the process, figuring out who is a good candidate. It's kind of like a puzzle.
And this quote really says it all. The entire success of this model, it really hinges on getting the patient selection right. This is definitely not a one-size-fits-all deal. It's a super personalized decision.
You can think of selection as a two-sided coin. On one side, you've got the social stuff. You have to fully understand what's going on. And, this is a big one, you absolutely need a responsible adult at home to help you out afterwards. Then, on the other side, you've got the medical factors. Your general health has to be good, and if you have any chronic conditions like diabetes, they need to be stable and well under control. And hey, it's not just about the patient's health. The surgery itself has to qualify. Doctors are looking for procedures where they expect very little blood loss, where the risk of any immediate problems is low, and where you won't need any special aftercare. Basically, your pain has to be manageable at home, and you need to be able to get up and move around a bit. Okay, so let's say you're a perfect candidate, and you've got the green light. What's next? Let's walk through the prep, because this part is key to making sure everything goes off without a hitch. It pretty much boils down to three main steps. First, you'll have what's called a preoperative assessment, where you'll chat with a specialist nurse and an anesthetist. Second, you have to follow the fasting rules, which usually means no food or drink for about 6 hours before the procedure. And third, your surgeon is going to go over all your regular medications and tell you exactly what you should or shouldn't take on the day.
All right, let's zoom out for a minute and look at the big picture. Why is this move away from long hospital stays so important for the future of healthcare?
Because here's the thing. Day case surgery isn't just a neat trick. It's a fundamental shift in how we think about medicine. It's about moving to a system that's more efficient, less disruptive, and totally focused on you, the patient, getting you home and back to your life sooner, and most importantly, safer.
And you know, all of this leaves us with a really fascinating question to think about. As our technology and our medical know-how just keep getting better and better, what's next? What other complex parts of healthcare that we always associate with a hospital could be brought safely and effectively right back into our own homes? Food for thought.